Maintaining proper feminine hygiene is an important aspect of overall health and well-being, but it's a topic that's often surrounded by myths, misconceptions, and sometimes even embarrassment. Today, let's break down the facts and focus on how to properly care for the vagina and vulva, what you should and shouldn't do, and how a simple, gentle hygiene routine can help you feel fresh and comfortable every day. First, let's clarify some basic terms, since they're often used interchangeably but refer to different parts of the body. The vulva refers to the outer part of the female genitalia. This includes the labia majora and minora, the clitoris, and the opening of the vagina. The vagina itself is the internal canal that leads from the vulva to the cervix. Understanding this distinction is important because the way you care for these areas should be different. When it comes to cleaning, simplicity is key. The vagina is a self-cleaning organ. It has its own natural, healthy balance of bacteria and maintains its cleanliness through the production of vaginal secretions. These secretions help flush out old cells and keep the environment balanced. So, the number one rule: you do not need to and should not wash the inside of your vagina. Avoid inserting soaps, douches, or any cleaning products internally. Doing so can disrupt the natural balance of bacteria and pH, which can lead to irritation, infections, and other problems like bacterial vaginosis or yeast infections. Instead, your focus should be on gently cleaning the external area, the vulva. Here's how to do it safely and effectively. Start by using warm water. For most people, that's all you need. If you prefer, you can use a mild, unscented soap, but it's important to choose one that is gentle and free from harsh chemicals, fragrances, or dyes. These additives can irritate the sensitive skin of the vulva and disrupt its natural balance. When you wash, use your hand or a soft washcloth. There's no need for vigorous scrubbing. Just gently cleanse the folds of the labia and around the clitoral hood. Rinse thoroughly to make sure all soap residue is removed. After washing, pat the area dry with a clean, soft towel. Avoid rubbing the skin as it can be delicate and more prone to irritation. Now, let's talk about some common mistakes, or don'ts, when it comes to feminine hygiene. One of the most widespread myths is that you need special feminine washes, sprays, or wipes to stay clean and fresh. In reality, these products are often unnecessary and can do more harm than good. Many of them contain fragrances, alcohol, or other ingredients that can irritate the vulva and throw off the vagina's natural balance. The best approach is to keep it simple and stick to water or a very mild, unscented cleanser if needed. Another common mistake is douching, which involves flushing out the inside of the vagina with water or other solutions. This practice is not only unnecessary, it can actually increase your risk of infections and other complications. The vagina is designed to clean itself, and douching disrupts this natural process. Medical organizations, including the American College of Obstetricians and Gynecologists, strongly advise against douching. It's also important to be mindful of what comes into contact with your vulva. For example, avoid using scented toilet paper, bubble baths, or perfumed hygiene products in the genital area. These can all cause irritation. When it comes to menstrual hygiene, choose pads or tampons that are unscented and change them regularly, at least every 4 to 6 hours, or more often if your flow is heavy. If you use menstrual cups, make sure to wash them thoroughly between uses, following the manufacturer's instructions. Let's not forget about underwear and clothing choices. Choose breathable fabrics, like cotton, for your underwear. Cotton allows air to circulate and helps keep the area dry, which can reduce the risk of irritation and infection. Avoid wearing tight synthetic fabrics for long periods, as they can trap moisture and heat, creating an environment where bacteria and yeast are more likely to thrive. Change out of wet clothing, such as swimsuits or workout gear, as soon as possible. After using the bathroom, always wipe from front to back. This helps prevent bacteria from the anus from spreading to the vaginal and urethral area, which can lead to infections, including urinary tract infections. During your period, daily hygiene remains important. Wash the vulva once a day as usual, and remember to change pads, tampons, or menstrual cups regularly. If you're using reusable period products, such as cloth pads or cups, clean them thoroughly according to the manufacturer's guidelines. Shaving or waxing the pubic area is a personal choice, but if you choose to remove hair, be mindful of proper technique to avoid irritation or ingrown hairs. Always use a clean, sharp razor, shave in the direction of hair growth, and use a gentle, unscented shaving cream or gel. Afterwards, pat the area dry and apply a fragrance-free moisturizer if needed. Let's also address some common concerns and frequently asked questions about feminine hygiene. Many people worry about vaginal odor, but it's important to know that a mild, musky scent is completely normal. Every vagina has its own natural smell, which can change throughout your menstrual cycle. Strong, foul, or fishy odors, however, may indicate an infection and should be evaluated by a healthcare provider. Discharge is another topic that causes confusion. Vaginal discharge is normal and healthy. It helps keep the vagina clean and moist. The amount, color, and consistency of discharge can vary throughout the month, depending on where you are in your cycle. Clear or white discharge without a strong odor is typically normal. However, if you notice a sudden change in color, consistency, or smell, especially if it's accompanied by itching, burning, or irritation, it's a good idea to check in with your healthcare provider. Some people wonder if daily panty liners are a good idea for staying fresh. While occasional use is fine, wearing liners every day can sometimes trap moisture and heat, which may increase the risk of irritation or infection. If you choose to use liners, opt for unscented, breathable options and change them frequently. Hydration and diet also play a role in overall vaginal health. Drinking plenty of water supports the body's natural processes, including the maintenance of healthy vaginal tissues. Eating a balanced diet rich in fruits, vegetables, whole grains, and lean proteins can support your immune system and overall well-being. Some research suggests that probiotics, found in foods like yogurt, may help maintain healthy vaginal flora, although the evidence is mixed. Sexual health is another important aspect of vaginal care. After sexual activity, it's a good idea to urinate to help flush out bacteria from the urethra, which can reduce the risk of urinary tract infections. If you use lubricants or other products during sex, choose ones that are water-based and free from added fragrances or harsh chemicals. Always wash your hands before and after touching the genital area to reduce the risk of introducing bacteria. If you experience persistent itching, burning, unusual discharge, or discomfort, don't hesitate to seek medical advice. These symptoms could indicate an infection or another issue that needs attention. Regular gynecological checkups are important for monitoring your reproductive health and catching any potential problems early. Parents and caregivers can help young girls develop healthy hygiene habits by teaching them the basics of gentle cleaning and the importance of not using harsh products on the sensitive genital area. Encouraging open, honest conversations about body care helps break the stigma and empowers girls to take charge of their health. To sum up, the key principles of feminine hygiene are gentle care, simplicity, and listening to your body. The vagina is self-cleaning. Leave it to do its job. Focus on washing the vulva once a day with warm water and, if you choose, a mild, unscented soap. Avoid douching, scented products, and harsh cleansers. Choose breathable underwear, practice good bathroom hygiene, and stay attuned to any changes in your body. Remember, every body is different, and what works best for you may be slightly different from someone else. If you ever have questions or concerns, your healthcare provider is always the best source of guidance. Taking care of your intimate health doesn't have to be complicated or intimidating. With these simple, evidence-based tips, you can keep your vagina and vulva healthy, comfortable, and confidently cared for every day.